Financial insecurity plagues much of the world. Billions of people don't earn enough to enjoy a decent quality of life. The current economic downturn caused by the COVID-19 pandemic will push millions deeper into poverty. The United Nations Capital Development Fund has spent more than 2 decades helping countries gain access to financial services and has made financial inclusion a priority for households and small businesses across the globe with great success. However, research shows that financial inclusion has failed to reach all people equally, with some populations lagging significantly behind. Put simply, financial inclusion is important, but it doesn't address the underlying barriers to financial security. This is why UNCDF has shifted gears to a more holistic approach, that of financial health. Financial health looks at 3 important aspects of an individual's financial life: financial security, financial control, and financial freedom. It's a model for determining how well individuals are equipped to handle financial shocks while creating the preconditions for building financial resilience or wealth. By looking at these as well as an individual's environment and perception of their finances, the financial health approach ends up being more thorough. In other words, financial health is a better approach to define, create, and measure impact. From piloting innovative financing programs and policies to promoting and supporting transformative investment, we've seen firsthand how financially healthy communities are among the critical drivers of a country's progress. Including people in the financial system is about more than having a bank account. It's about helping them build healthy financial lives and participate in today's connected economy. This goes a long way towards reducing poverty and meeting the 17 Sustainable Development Goals, which calls on all countries, poor, rich, and middle income, to promote prosperity while protecting the planet by 2030. The economic recovery following the COVID-19 pandemic will be a long process, and we still have a long way to go to address the many persistent financial inequalities that afflict the less fortunate among us. But here at UNCDF, we are hard at work, galvanizing our own expertise and resources and those of our partners. And it is in this inclusive spirit that we strive to build financially healthy, resilient societies.
Hello everyone, I hope you all enjoyed the video. My name is Rakhi Sahai and I'm part of UNCDF's Center for Financial Health. Today, we all have gathered to announce the launch of our flagship publication, Delivering Financial Health Globally. This publication is actually a collection of insights, approaches, and recommendations on financial health. With this, I would like to invite Ms. Preeti Sinha, Executive Secretary at UNCDF, to officially release the white paper and open today's event.
I am very pleased to be here today with you. As the UN's flagship financing agency for the least developed countries, the UN Capital Development Fund offers last-mile financing solutions that unlock public and private capital, especially at the domestic level, to reduce poverty and support local economic development. I'm also very proud to be here today as the Executive Secretary for the UN Capital Development Fund. It is my pleasure and privilege to be here today to help launch this white paper and to open this webinar roadshow series on financial health. Before I start, I would like to take a moment to extend my gratitude to all of you for taking the time to be here and to consider what financial health truly means for the people and communities we serve, as well as what all of us can do to enhance their financial health. And our efforts in the least developed countries, or LDCs, reflect our core vision. that of deploying innovative finance approaches that successfully crowd in public and private finance, therefore creating a demonstration effect that can develop and transform markets, shift the dynamics of financing towards the local level, and ultimately catalyze the system change that helps ensure that we truly leave no one behind. As I see it, helping deliver and strengthen financial health is a natural and essential part of our mission to make finance work for the poor, particularly those in the last mile or the frontier markets. Now we are all more or less clear about what financial inclusion means, as well as the progress that we have seen and witnessed and contributed to that so far. Over the last few years, we have dedicated our time and effort to expanding access to financial services and driving its usage. According to the Global Findex, 1.2 billion adults have obtained an account since 2011, including 515 million since 2014. Between 2014 and 2017, the share of adults with a financial account rose globally from 62% to 69%. Developing countries during the same period saw this proportion increase from 54% to 63%. These numbers prove that through the decade, we would witness tremendous progress in bringing the unbanked or underbanked adults into the formal financial system. And as we have achieved this early gains in the financial inclusion, the metrics that were used to measure success at the time were appropriate. The number of account holders, the number of withdrawals and deposits, and the number of digital payments to existing gender gaps, and so on. These indicators helped us measure the extent of financial inclusion. But what did they tell us about how a person, a family, or a community is able to navigate their financial lives? How does knowing the number of account holders tell us whether a family or an individual is able to withstand financial calamity without liquidating their assets? How does the number of withdrawals tell us if a family is able to send its children to school? How does the number of digital payments tell us if a couple can pay for medical needs without completely going under? Ultimately, how do we know that access to a bank account or the usage of a deposit scheme or a digital credit scheme translates into actual improvements in the lives of people? Whether the access is placing more income in their hands, lifting them out of poverty, or making societies more equal, all of which would support the achievement of the Sustainable Development Goals. This is where financial health comes in. While the digital revolution has resulted in a wider set of services being provided via digital platforms in such areas as agriculture, energy, health, education, entrepreneurship, we have also learned that inclusion in the digital era is not a given, that technology in itself is neutral, and that it can lead either to inclusion or exclusion based on how it's deployed, and whether it is accompanied by measures to ensure that the new forms of exclusions are not introduced. In fact, what we have already seen is that digital economies in their current growth patterns are not always naturally driven to be inclusive and may further deepen divisions within economies. As we think of making finance work for those in the last mile markets, we see that financial inclusion, unfortunately, has a tendency to be reduced to binary propositions, financial inclusion or non-inclusion, as opposed to a discussion of a spectrum. Financial health expands the discussion to include how informal mechanisms and non-financial factors play a role in people's financial lives. A renewed part of our inclusion effort is applying this broader focus on financial health towards our work, wherein individuals and communities will be able to save more, borrow and repay in a healthy fashion, and insure themselves adequately to mitigate risk or economic shock. We should always remember that financial health does not exist in a vacuum. It is linked to the real economy. The lesson has become quite relevant in context of the COVID-19 pandemic. As communities throughout the world and communities in the LDCs in particular suffer the effects of lost jobs, incomes, and assets, there is a critical need to think beyond financial inclusion. We must now look to deploy the wider set of tools and services that support the most vulnerable segments in the last mile communities. Women, youth, and informal workers, such as gig workers and migrants, so that they can meet their daily commitments and secure their financial futures. But a financial health approach will also help transform local economies so that they are stable, inclusive, resilient in the future. Financial health can drive good personal health and education outcomes, as well as reduce poverty and inequalities. And of course, if we want to achieve a broader array of the SDGs, whether it's in good health and well-being, quality education, or reduced inequalities, then financial health of end consumers is a necessary objective. The work that we have started on this global initiative on financial health is anchored by a Center of Financial Health and Innovations at the UN Capital Development Fund, which aims to build evidence and convene conversations that can contribute to the global transition of building an inclusive and a sustainable society. The white paper that we are launching today brings together some of the early lessons from the center while articulating the importance of measuring impact, as well as the role of the government, private sector, and civil society. Today marks the start of a journey where we want to invite all of you to join us as our partners to build and advance the agenda of building back better. It also serves as an effort towards a common and shared understanding on the subject of financial health. We will also aim to build a coalition of public, government, and private sector actors who would be willing partners in a collective learning and action towards enhancing financial health globally. In closing, I would like to thank the MetLife Foundation, which has been instrumental in helping shape this white paper, as well as all of the other government agencies and foundations with whom we are working to take the financial health agenda forward. Thank you very much.
Thank you so much, Preeti. Moving on to our next segment, let me welcome Jaspreet Singh, Global Lead Financial Health and Innovations, UNCDF. Jaspreet is going to talk about some of the key findings from the paper, and also how financial health as an approach can help both policymakers as well as private sector agencies to help achieve SDGs. Right. So before I ask Jaspreet to come, a request to all participants to, you are more than welcome to post your questions on the Q&A box, and we will take it up soon after the panel discussion. Jaspreet, over to you.
Thanks, Rakhi. Thank you so much. And good morning, good afternoon, everyone. Thank you so much for joining us from all across the world. I'm Jaspreet Singh, part of the UNCDF team. And before I really, get onto this conversation of white paper and, what does this white paper really contain in terms of the scope and, what we have kind of been able to build over last year. I think I just wanted to basically pick up on where Preeti Sinha, who was mentioning of, the need for shifting gears and shifting to a new vision, broadening the vision from where we are today. And the reason, why we need to do that possibly. And this comes on the heel of the point that when we were doing this white paper, this question actually also came in front of us that, is inclusion not sufficient enough on its own? And, why should we be moving to financial health or well-being? What is really missing in this conversation on inclusion, which we all have so strongly, been building over last decade and more, and what needs to be done now, which has not been done enough. And possibly, with inclusion, we have got to a point, we've got the infrastructure out there. We have built the last mile connect. We have been able to, equitably distribute products and services to the most vulnerable societies, be it women, be it youth, be it the MSMEs, who are often left out, in this broader conversation and also who were not able to participate actively in building an inclusive financial system. But possibly this is, where the story or the journey really starts, that, inclusion has actually laid out the foundation, which has been an important prerequisite. But, that is not the end goal in itself. Possibly, we need to look at how the efforts we have made with inclusion is actually, converting into something more impactful for the people and citizens that we serve. And this is, just a perspective of it, that people have bank accounts, but possibly they're not able to, save for emergency savings as and when they need it, right? They might have access to different services, but possibly, they're still struggling in many ways. And the current pandemic has just exposed all those vulnerabilities in front of us, in terms of how weak we are in terms of, all the infrastructure and great leaps that we have made in terms of what all we need to still do in terms of, really achieving the end goal of improving people's financial lives, because that's, where we all trying to assert ourselves and really getting focused on. But even, speaking from a consumer perspective, which I was trying to put over here, let's even shift the gears and look at the macro perspective of this. Why is really financial health important? Across last decade or so, we have seen countries after countries, improving in their GDP, per capita income, country levels, across markets in Asia, Africa, South America, going from where they were in 2010 to, where they are in maybe sometimes doubling and tripling in many cases. But the larger question kind of still remained, with all of those growth numbers that we have seen across markets, and this is not only one market, this is a story for across the geographies, that how is that translating into, really improving people's life? We have been hearing governments talking of how they've been able to reduce poverty, but when we basically start looking at unpacking the idea of, are people living a good enough life? Are they basically being able to do enough, basically carry on their life in case of emergency or a situation like pandemic, where the lockdowns and job losses were so common that, people were not able to fend for themselves, and they have to, depend on a lot of government support to basically continue their livelihood for that matter. So the real comes in that, what have we been striving for, So yes, the current indicators are a good measure of where we have come across already, but we need to kind of possibly do more in terms of both from a macroeconomic perspective and looking at this correlation between where we stand financially at the individual level. And this is not a story of one market or two markets across the globe. This is a story which basically goes across the countries of the world, be it developing or even the least developed countries. We have seen financial inclusion numbers go off the roof, but again, people's financial lives not being able to meet up with what they would have expected. Having a increase in per capita income possibly is no guarantee that the citizens of that country are productive in nature, or are able to kind of live a life where with well-being which they would have expected. This is what the government actually expects. So I think there is a lot of merit in this conversation, that which not only comes from the fact that the bank accounts are not sufficient, and maybe people are not using the bank account in the way that they should be, or insurance is not sufficient and they are not deploying it in the way. But I think there's a lot of connection which kind of links it back to the real economy conversation, which is what the secretary was also highlighting on, that all of this conversation on financial health and well-being really is trying to look at that. If your citizen is productive at the last mile, it will start building up and basically help collectively push the economy up, but also make the financial sector more stable, more robust, and more long-term in many ways. And this is what this white paper intended to do, really starting to understand what has been the work which has been done in the space of looking at what is beyond inclusion in its current form, which is how do we look at inclusion beyond access and usage. What does it mean to really look at outcomes, which is financial resilience, security, control, and freedom. And this paper is actually a accumulation of work, which has been done across the global world. That can be a good reflection of how we need to take this conversation forward and build on to these learnings to be more anchoring in the markets where this conversation is yet to start. The first two sections of this white paper really delves into unpacking this idea and concept of financial health, the outcomes we are mostly talking of. How do we move beyond that access and usage conversation? What does it really mean to have an outcome focused conversation? The second section will really delve into those details in terms of looking at the building blocks of what financial health means, what are the determinants which affect it, what are the pathways which we could adopt possibly to take to achieve those outcomes in a way, and what are the combinations in which that can be done. How have other markets actually worked around these things, and what are they still learning possibly. The third section really takes that definition and put it into a context of measurement, because there's this whole saying, if you can't measure it, you cannot make a change, right? And possibly this has been the most important aspect of financial inclusion win, that because we were able to measure financial inclusion and success against a binary parameter of number of products in the hands of people, possibly that become a good indicator for markets across the world to start measuring their success against a certain point where they were 10 years back, where they are now. But then the question really comes in, if you can measure the access and usage, can you also start measuring the outcome? What will it take to measure outcomes, right? There are good evidences in terms of how this could be done, but possibly there's a lot of work which has to be still done. If you want to create a global benchmark of index, which can be compared across the markets, and which will give tools in the hands of policy makers and governments, even institutions, to look at how they should be measuring the success or their work against that index basically. From measurement, we really start looking into how do we convert this into more actionable? What is a business use case for private sector? Why should they be investing in this, especially the financial service providers? What's in for them largely? Why they should be looking at what they're doing right now. They've been doing great in terms of building the infrastructure, getting the accounts out there. But then what is really left out? Why should they be worried about the financial health of their consumers, and rather not look at the product and services they are supposed to serve. But I think it will also come back into this conversation today as we start this journey of webinars in terms of why the private sector should be looking into it. What are those different institutions which have actually been taken, which have already kind of started this journey in a way. What are they learning? How they intend to kind of shape this conversation and learn further from this. Then the last section of this piece of white paper will really look at how governments and policymakers as a whole should be looking at this arena of financial health. Every government wants their citizens to be productive, to have a better well-being. But then, are the policies reflection of that? What needs to be done in that context? And are we doing enough? If not, then what are the gaps which we need to be addressing? So these 5 sections of the white paper, which have been individually written to answer these various aspects, can be treated as individual pieces of work, and can be picked up and used for a specific purpose. But I think today's conversation, we really want to mark and start by looking at when the rubber hits the road with the private sector and the business use case over there, what will it really take to convert this conversation into action? Okay, and really ground it within a context of players who are supposed to be the intermediaries carrying it forward, in terms of delivering on the ask of building this outcome-based focus business. So I'd like to hand over the floor to my colleague, Mr. Krishna Thakkar from MetLife Foundation, to take forward this conversation on financial health in perspective of private sector. And towards end of this webinar, before the closing, we will also be sharing a call to action as we look at and look forward to building a global coalition across the developing world in coming together and participating in building this agenda forward. So Krishna, over to you. Thank you so much.
Great. Thank you, Jaspreet, for the presentation and setting the context so well. And good morning, good afternoon, good evening, everyone. Thank you for joining us today. I will just, diving right in, I think we're running a little late, but I will just spend the first minute or so to start with the why, right? As in, why is it necessary for us to have these conversations or these conversations? And let me begin that with acknowledging the progress we've made on the inclusion front and echoing Preeti's point in her opening remarks that just in the last decade or so, we've included more than 1 billion people, perhaps a lot more if you consider just digital mobile banking accounts, in terms of improved access and usage of basic financial services. And this is mainly driven by technology, digital, which is terrific and needs to be recognized. But I think it's important that this access and usage push that if people are able to access and use financial services, that will automatically lead to better financial health outcomes or improved financial lives. Now, as Jaspreet shared in some examples, both from a client perspective and the economic perspective, that assumption is not only wrong, but dangerous, right? What is happening is a classic case of what we call, we are hitting all the targets, but missing the point. So the conversation is essentially about how do we continue hitting the targets, of course, but also make sure that we're not missing the point. Now, that point here being what we can all do to improve financial lives and financial health of low to moderate income people, which I believe is the shared vision that brings all of us, most of us, if not all, together here. And then, of course, that conversation would rather be pointless without the private sector or financial providers in the room. And we are truly fortunate today to have some of the best minds from the financial sector for the discussion. I will introduce them in one moment, just the last minute and wrapping up. So in terms of the main objective of the conversation, the biggest question we kept hearing, and as Jaspreet mentioned while we were writing the paper, speaking with experts and leaders, is building a solid business case around customer outcomes is difficult. Both internally and externally. And why should financial providers care about their customers' financial health beyond the remit of their products and services? So we thought, let's take that issue head on. And here we are, we are extremely fortunate to have a stellar panel comprising of two of the best global financial providers, MasterCard and DBS, as well as GoGet, a leading workforce platform who we've been working with for the past couple of years. And let me briefly introduce our panel, and then we'll jump right into the discussions. So Payal Dalal, we have Payal from MasterCard. Payal is currently a Senior Vice President of Social Impact International Markets at MasterCard Center for Inclusive Growth. She oversees the center's philanthropic investments around the globe, and Payal brings her rich leadership experience with some of the largest public sector organizations, including the Clinton Global Initiative, Global Philanthropy Forum, and was previously the head of community programs for Standard Chartered Bank. Welcome, Payal. Look forward to speaking with you. And then we have Francesca Chia from GoGet. Francesca was recently named as one of the 112 young global leaders by the World Economic Forum. So congratulations, Francesca, for that. And she's also a co-founder of GoGet, which I said is a leading on-demand workforce platform in Malaysia. And finally, we have Bidyut Dumra, who's an executive director and head of innovation at DBS. He brings with him an amazingly diverse experience with leadership positions across multiple sectors like aviation, entertainment, telecommunications in several markets across the region. At DBS, he looks at building and delivering ecosystems, partnerships, digital strategy, and innovation. And in parallel, Vidyut is also an entrepreneur who has co-founded multiple startups and ventures. So last point, and then we jump in. Here is how we'll broadly structure the discussion. Depending on the time, Rakhi and Palvi, please keep us on track. I will open the conversation by asking a couple of questions to each of the panelists. We'll try our best to keep it conversational and fast moving. After going around with a couple of questions, we'll then have a quick sort of panel crossfire round. That's experimentative. If it goes wrong, it's on me. Where our panelists will get back to ask one question to another panelist. And then we'll open it up for our audience in case they have questions and if we have time. So jumping right in. Payal, if I may start with you with a basic but important question to set the tone. We didn't spend a lot of time on the definition of financial health, but what does, and again, terms matter less. The point is, but what does it financial health mean in your or MasterCard's context, right? And you may be using a different term for it. That's of course perfectly fine. And I don't know if it's the same question or different, and how will you explain it, right? A lot of the times, like to somebody like my grandmother, one thing that I've often struggled is to translate, our work to people like my grandmother who ask me, like, what do you exactly do? So how do you explain sort of that concept in a really simple way? If we can begin with that.
Thanks, Krishna, and thanks to UNCDF for the invitation to speak on this really important topic. So, to your point, Krishna, we all call it different things. We call it financial security at the MasterCard Center for Inclusive Growth. And for us, it means helping individuals, workers, and micro and small businesses not only get access to the financial tools that they need, but also to make sure that they know how to use those tools and services effectively. And what we mean by financial security, or in this case, financial health, is that people have the ability to pay their household and business needs, save for the future, weather shocks, borrow to invest in their families or their businesses, build financial resilience and manage risk, increase their net worth over time, and to develop a trusted financial profile. And in our work, Krishna, we look at financial security from various perspectives: the worker, financial service providers, and micro and small businesses. And really, I'd say our work on financial security really sits at the intersection of digitization and financial services. As a technology company, of course, we believe technology can be a really great innovator and enabler. So I'll stop there because I know we're doing quick rapid fire questions, but happy to speak more about what we're doing across financial service providers, workers, and small businesses.
Thank you, Payal. Thank you for setting us up. Vidyut, if I may turn it quickly over to you, and curious to hear, your and DBS's take on financial health. Is there a different way you would describe it?
Actually, let me start by picking up that part of how do you explain it to your grandmother. So I'll work the other way because I saw you had mentioned that. I mean, for me, I'm a visual person, and so just let me paint a scenario out. I'd get my grandma to sit on a table. I'd put 3 plates in front of her, one big plate with a small plate on top of it, and then one right on top. So 3 in line and 1 on the top. And I'm going to tell my grandma, because it seems that as you get older, they seem to get a real niggling for a sweet tooth. So I'd say, okay, in the kitchen, on the kitchen counter, there's cakes and donuts and everything. You can only use your plate to go to the kitchen and bring cake and donuts back. And then these 3 other plates are your grandkids. So you can take your plate, bring something back, and then you got to share it amongst the other plates. And then I'd basically say is that going to the kitchen and bringing it, that's how you create income. But the 3 little plates are your grandkids. One is your house payments, your hospital bills, your electricity. So I'd visualize it that way. And why the big plate and the small plate? Because I know all grandmothers, they like to put water around anything sweet so it protects them for the ants. So it's all about visualizing that you need to make sure that your plate is full enough, and then you can essentially allocate to your little grandkids and the balance. And when we talk about financial health, it's about not having to worry that your plate or your grandkids' plates are ever going to be empty. So that would be a way that I would, I guess, paint the picture to my grandma. And in regards to how we look at it in the bank is our articulation is what we call NAV planner. We feel everyone's life is a journey and they all might be going in different ways. And what we want to do from a navigational planner is we want to help them always find the best weather, the strong wind, the supporting current. But while the need is to try and get them in that, let's say, green track, we also want to ready them for when the seas are rough and the current works against you. And I guess the forces of nature don't work in your favor. So we are on this, I guess, where we are looking at being that support or that navigational planner, that compass that our customers can use.
Fascinating. Thank you, Vidyut. I wish, I think for both us and you and team, we should also start using such sort of visual metaphors, even in our papers, right? It seems to, starts to look dry when we now compare it with what we've written. But thank you, Vidyut. Francesca, moving to you. You've had an amazing sort of journey, but tell us a little bit more about your journey and what GoGet does. Especially given the fact that you could have almost picked any problem to solve And that goes with the startup world, they want to pick something which is relatively simple or focused. But what led you to, what was that insight, experience, or moment of truth that led you to pick this relatively complex problem of financial health and employment to solve? So,
yeah, sure. Just for everyone's perspective, I guess, just to give an introduction what GoGet does specifically, and I'll definitely go into the aha moments. So GoGet is an on-demand workforce platform where we connect businesses today to verified and trustable workers on demand. So we call them go-getters, actually. And essentially, these go-getters can be anyone who comes onto our platform, gets verified, and if they seek to find an opportunity, network, gain a new skill, they can go on, find a very micro job. I call it a micro job because it's not a full-time job. It's not a full-time position. It's really could be 1 hour, it could be a task base. And then they can do that job and then get paid all through the app. And now we also provide financial services such as savings, coverage such as personal accidents coverage, and even financial awareness and education. And so a little bit of, I would definitely say for me, it was not a moment of truth, it was multiple moments of truth. One was definitely at the very beginning, when we started GoGet, we did not start it actually with that whole vision of even financial inclusion for this conversation's perspective, right? What we did is we thought, one, mobile phone technology was going to get cheaper. It was going to make that mini computer inside everyone's pocket, and it was going to be going around the city. We knew with that, the connectivity in the city would just change. So we could now not only give information to another person across the city with a blink of an eye, but you could actually give enough information to actually even transfer work, a transaction that would actually be a task. And then we could even safely pay for it, and these two individuals would not need to meet. So that was really the first moment that we said we would be able to essentially crowdsource and connect the city to be more efficient, and then create opportunities that never existed before. But the second aha moment was we thought actually students would be the main users because students would like to earn flexibly. No, majority of people that we first onboarded that walked through that door were people who had full-time jobs. I remember an individual walk in and he did not, he had a VW for a car, and I said, are you looking to earn extra? He says, yes, I work in a bank, just 9 to 5. I would like to earn more though, because one of the fundamental things that exists in every economy, inflation will always precede wage rises, right? So wages will not increase as fast as inflation. And different countries, the disparity is different, but with that, people don't earn enough on what they want. So those were a few of the aha moments that I said, wow, I think we really need to be solving the larger labor market inefficiencies that exist today, which really brought me to kind of where we are today.
Thank you, Francesca. We'll get to you with I think we can now start taking us one level down to some specifics. Bidyut, you've done some terrific work around using the power of innovation, behavioral science to improve customer outcomes. Now, we'd love to hear a bit more about your approach and experience, and how do you go about understanding your customer, use those insights to inform your strategy, products, technology?
Yeah, sure, for sure. I think this is also even very much linked to even how we evolved and the aha moments that was from the previous question. To give you an example, the first thing we do is we do firstly tell everyone, even in our team, we are a two-sided marketplace, so we do not own any side. In fact, we are the best championers and cheerleaders at the side of the ring, but we're not the players in the ring. So at most, we should have the front row seat so we could see things a little bit clearer before the other audiences. So we could either decide, do we need to upgrade the stage? Do we need better lighting? Do they need better equipment so they can have an amazing time in the ring? That's exactly what we need to do as our philosophy. And so what we say is, our users are the real extension of actually our product, and we need to make sure both of them are set up for success. Hence why one of our values is that we need to be really grounded onto both sides of the community. We need to be talking to them. We make everyone in GoGet, for example, in our actual office, they are all go-getters and also users. You cannot join the company without actually being a go-getter. 30% of our staff is actually from the go-getter team, and then they became the staff. So it's almost a community building the community platform, if that makes sense. We run a lot of everything we do. We run a lot of tests. and a lot of iterations around those. And we typically roll out very small changes so that we could go fast and actually adjust for that. And the main example to show you that aha moment, I had a go-getter walk in and he said, I know you verified with this bank account, but could you send it to another bank account? And I was like, why would you like us to send your income to another bank account? He goes, because I then will not touch it. I will save it there. And then I will use my other account for my working account. And I said, oh my gosh. So this is so simple for them. They just had another account that they just didn't touch. So the act of wanting to help them save, that's how now we created, actually, you can save with a click of a button, as low as 1 cent from our app directly to a saving app. And now the go-getters can save instantly with their income. So that's an example of kind of really keeping close to them, understanding why, and then really building into a design sprint.
Super, thank you, Francesca. I love how you said that. It's amazing that 30% of your of your even staff is from were actual go-getters. Terrific. With you turning that question over to you,
sure.
As a large organization, how do you sort of blend innovation, behavioral science, customer insights, and turn them into impactful sort of solutions?
So let me take you on a little bit of a story of how we came to this realization that we need to do more. At one time, this is going back about a decade back, DBS, if you asked anyone, what is DBS? They'd say DBS, damn bloody slow. We were notorious for our lack of speed and service. So we introduced a lean methodology, and we introduced it with a view that we could make our processes faster. So we look at a process and remove all our waste. And we ran this PIE on a credit card loss process. You lose your credit card, it would take 5 days for us to give you a new credit card because the process took so long. So we did this PIE and we chopped up the process and we reduced it to 1 day, 24 hours. And we waited for the first person to call. A lady called, stopwatch came out, click, 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 click. The next day she had a card in her hand. And we were thrilled. We went over to talk to her and we said, listen, we've done 5 days to 1 day. What do you think? And she was like, this is amazing. Thank you, thank you, thank you. But where's my debit card, my passbook, my token, everything I told you I lost on that same call? That's when we realized we were thinking of the customer as a process, but not thinking of the customer as an intent. So we brought in design thinking and behavioral science into the organization. And we have a proprietary tool that we call the 4D. So it's the discover, define, develop, and deliver. So it's an internal practice that enables the organization to put the customer at the heart of what we're trying to do. And now we say that the newest D is data, because it's no surprise that an organization like us, with 50 years plus servicing the nation and our various customers, we've got plenty of data. So now being able to bring technology and bring that on top, because the reality is customers don't always say what they want and don't always do what they say. And the ability to use technology and data and innovation to get clues to what really makes a difference, that has been really monumental for us. So the framework and the methodology came in via us learning the hard way that we were doing things wrong. But now we've figured out and been able to implement these journeys, and they seem to be paying off. We're not called damn bloody slow anymore, so at least we regained the title of the digital
from
bank.
That to the world's best bank.
It's been an exciting decade for sure.
Very terrific. I think that transformative moment where you kind of move from a product-centric view to a whole customer-centric view is amazing. Payal, getting to you now. So just making sure we're on the flow. Every couple of years, we keep hearing these new, seemingly trendy terms, like customer centricity, digital transformation, and now financial health. And I was wondering, how do you navigate through these trends internally, right? Like, does it get overwhelming? How do you sort of see that? And including, financial inclusion, digital transformation, customer centricity, yeah.
Great, thanks, Krishna. So I think these concepts and trends have always been around and will always be crucial. I think digital transformation and customer centricity are the means through which we achieve financial health. And then of course, financial inclusion is that first step towards financial health. And I think these issues are more important now, given the volatility of COVID-19. And our work, what we've done, one of the examples is that we've been working to digitize the wages for garment workers in Bangladesh, Cambodia, and Egypt. And in that program, we've really brought together financial inclusion, customer centricity, and digital transformation to really realize financial resilience and financial health. And I think the key here, Krishna, is that the transition to digital is not simply about replacing cash transactions with digital transactions or simply providing a digital wage solution. Rather, it's about greater access to and use of a range of digital financial services, which can really be a stepping stone towards that enhanced outcome we're all looking for, financial security, inclusion, and health. So in Bangladesh, Cambodia, and Egypt, we've been working to bolster the financial health of these garment workers by digitizing their wages, but we just don't convert their cash to mobile money. We started by understanding that the garment worker we started by understanding what their needs were and starting to work with the bank to really develop financial services that suit their needs. And then we put the garment worker at the center of our product design process. So back to that customer centricity point. But we also provided financial capability training to ensure that the workers were comfortable with their new formal and digital financial services. And I think what's really important, and a point we haven't really touched on yet, is the importance of trust. And so one of the things that we built in was to really ensure that the garment workers understood and trusted their new mobile digital financial services. And so we employed a peer-to-peer learning model because we found that workers were much more likely to listen to and trust their peers over, say, factory management or outside trainers or representatives from the bank. So again, this is just an illustration, Krishna, of how central customer centricity, digital transformation, financial inclusion are, but you have to think about it in a holistic way and how they all kind of work together to complement so that they actually drive that outcome we're looking for.
Great, thank you, Payal. Great example, and I'm so glad you mentioned and added trust at the end. And that's, if you have a chance to go through the paper, that's kind of how that private sector section ends. That's kind of the true sort of thing that underpins all currencies and all relationships, right? Financial or non-financial. So very crucial. Moving on, I'm just looking at the time, making sure we have enough time for the sort of round of questions. Raki, tell us if we don't, but I'm moving forward. So final round of questions before we move to the crossfire. Maybe Francesca, what is your call to action? In terms of policymakers and for private sector, like, is there anything you'd like to see?
It's a great question, because I think we are definitely in a industry where the regulators have yet to fully understand, because the players themselves are also the first are building it as we go, right? And I must say, already many regulators and even researchers are writing papers. They're trying their best to catch up, and we have certain forums where they engage us in feedback. I wouldn't say there's nothing that is being done. I would say that definitely really done at least significant initial steps. In Malaysia specifically, with our space, we are looking at the informal sector protection, financial protection, and we've been able to champion, at least directly to the government here, to really protect the workers here through not only a flexible way to contribute to their pension fund, but also a flexible way to contribute to their social security in terms of coverage. And these are the two agencies in Malaysia's EPF as well as SOCSO. And they have reacted in a positive way to at least try to create new models. So with the pension fund, they actually allow us to, for example, self-contribute. And then as a platform, we can funnel their income actually to the pension fund. And it's just via hopefully an integration, which we're actually currently in talks with. But and same with SOCSO, they have also created a program for informal workers for a 1 year annually to be renewed. Now, that being said, what I would say is my CTA to them is that to not apply traditional frameworks on a new economy or on a new space, because what I tend to find is that these policies, for example, the Social Security program that they created was an annual program. It was a cheaper program, of course, to subscribe to. You only have to subscribe it annually. But in our economy, in the informal sector, who plans for a whole year of employment? They come into the platform. If they want to work for a day, they will work for a day. If they don't want to work the next day, they will choose to not to work the next day. But that's the beauty of the flexibility that platforms like us provide. But if I go to you and say, I'm sorry, the only way you can get protected by the government is if you buy the full year annual program. And they would say, but what if I'm not going to use your platform in a month? And I'm like, it's a great question. I have tried to create a 1 month program, but this is because you can see it was a traditional framework trying to make a policy for a new age product, and it just didn't work, right? And we're still trying to lobby for changes to make it just more flexible. So, and I don't necessarily blame the researchers or also the government. It's hard because they are trying their best to see it from their perspective, but I would encourage them to either, work a week in the innovation arm of companies or with the team. Join the meetings, join the focus groups. These are the only ways I think their mindset can be opened up, because otherwise, no matter what we say or read, you'll never know until you actually really feel it and see it, right? So I would love if more people in the government actually take a lot more of an active role of engagement in the discussions with the users. That would be amazing.
Just a quick response to that, Francesca. It's even amazing that a startup like you is engaging with the government for a conversation like this, right? But just curious, when you told them this, like, I hear that they're engaging, but when you shared this, what was their response? I mean, of course, I understand why it would be difficult, but like, I just wonder, what did they say? Yeah.
We've communicated these asks, and unfortunately, we are met with, we'll get back to you. And I get that it requires a few layers, and they're also not empowered on their layers sometimes. So a lot of this, sometimes you need to come from the top to give the empowerment so that everyone that's talking to relevant stakeholders can make a decision. But I get the we'll get back to you. At least it's not a no, but it's a we'll get back to you.
Yeah, that could be painful. Good, thanks. Payal, so switching to you, do you have any call for policymakers?
Yeah, I think I have a couple. And I would say that the first is really that we have to find a common definition, a common goal, a common set of measurement frameworks so that we can really align. And I know the paper that UNCDF and MetLife have put together, I think, is a really good place for us to start with that alignment. Because, to your initial question to me, Krishna, there are so many ways we're talking about it, and we even have so many different terms, depending on who you're talking to. I will talk about financial security, somebody else will talk about financial well-being. And so I think starting to try to standardize that nomenclature is going to be really key. But that requires some effort. So that's my first call. And again, thank you to all of you for creating this paper, because I think that could be our common rallying point. The second thing I'd say is that I think while I think our intent is to further the financial health of everyone, I think we're still really operating in silos. And so I think we need to have, and I think this conversation is a fantastic start, I think we need to have more dialogue across sectors, across industry, to really figure out how we're going to work together to actually achieve this, because this is a monumental goal. And it's taken decades to even mainstream this concept of financial inclusion. And I think we really don't have the time to spend that same number of decades on financial health. So that would be my second call to everyone listening, is how do we actually work together? And then the final call I would make is, there have been a number of organizations that have been on this journey. There are some governments that include financial health in their central bank questions. There's some banks that report and measure financial health. And so my last call to action would really be, we need to be able to leapfrog. And the only way to leapfrog is to be able to share the learnings we've generated to date to share the failures we've generated to date. So that way we can really collectively move forward more quickly. So those are a few things that are on my mind.
Thank you, Payal. I'm seeing messages, frantic messages from Raki and Palvi. So just 20 seconds of summarizing this, and then we'll go to you asking questions to each other. But yeah, it is as you said, it's even Vidyut, it's kind of a more expansive concept and a little more complex than just inclusion. And Vidyut added the income dimension right away when we mentioned financial health, and that's where Francesca comes in too. Yeah, so it does become a bit more complex, and that's where I think these dialogues and partnerships. Thankfully, I think technology makes it easier. There is no other way we could have gotten together, even when a physical setup as ideal as it is, but at least we got together. So. Yeah, those important points. I will jump in right away. It's a lot of the times I was just experimenting this. It's moderator asking questions and panelists responding. Let's kind of turn this quickly around, go around, where the panelists can ask other panelists, not me, a question. Let's start with Francesca. Do you want to just go first? Please say one question you have for one, either Vidyut or Payal, and we'll go around Francesca, Vidyut, and Payal. Yeah.
Thank you. Thanks so much. I'd love to ask questions with you. This is pertaining, of course, in your position, especially because your stories also really embody so much innovation already at heart, and I can see that with design thinking. So I'm so curious to see, especially in your position, you have so much influence on this in terms of innovation culture within DBS. What kind of products, services do you envision, in the next 5 years from now, if your vision is successful in terms of innovation?
If my vision is successful, wow, it's going to be a very scary world. But let me give you an example of a product that I thought was so super cool. Okay, so insurance. We have plenty of insurance for this physical world. I can insure your life, your car, your house, when you travel, etc. But more and more people are living a digital life, and people have a digital avatar or digital persona. So when we talk about products of the future, we started looking at the relevance that people have to this digital life. And in some instances, they have a more of an emotional connection and, I guess, an impact on that virtual persona or virtual life as much as the physical. And we're like, what the hell are we doing to protect that? Not much. So we started looking at a range of products of the future that could assist that. Because when you talk about financial health and financial well-being, we found that if a person doesn't have the right level of security, protection, or even income, it creates to adverse relationships in their own mind and with others. So we started looking at insurance products that will protect your online identity against theft, insurance products that protects you against cyberbullying. So a wave of these products that might seem a little very nascent to the world or decision makers that are buying insurance now, but it's going to be very prevalent in the future. So products like those that it's obvious that there's a thoughtfulness and there's a consciousness, and we have this mantra. So Min's on the call. We have this. We talk about Jedi innovation, and we say that there's a disturbance in the force right now because for yonks we've been driven by fear and greed. And we have to recorrect that balance. So I'm looking for products that within the innovation paradigm, we not only think of, do the customers want it, will we make money and can we do it, but is it the right thing to do? So those are the kind of products that I'm hoping are going to be mainstay.
Exciting. It sounds really exciting. I mean, to give you a sense also, I've started to get also a lot of new types of insurance being proposed to me just because we have a digital platform, and I see exactly what you're saying, and it's fascinating. I didn't even know products like this exist.
So yeah, it is definitely an exciting space. So now that you asked me the question, I think the baton passes on to me. So I'll hit up Payal. Payal, I mean, there's so much happening in the world, and I think you also mentioned about trends. From your perspective, if you look over the horizon, I mean, what could be that game changer to financial health? What are those trends and developments you think are going to be the ones to place bets on?
Yeah, it's a great question, and I don't think there's enough time to go through everything that we're seeing, but let me just highlight a couple. One that is making me really optimistic, if I look through the kind of financial service provider level, and we work a lot with microfinance institutions, the pandemic really required a different way of thinking, especially for microfinance institutions that were faced with moratoria, which meant that the financial service products weren't fair for individuals and for small businesses. And what we saw across the world was that microfinance institutions stepped into really unique places, right? They went beyond just the provision of financial products. We saw MFIs start working and helping their clients with digital literacy. We saw microfinance institutions help them actually connect onto e-commerce platforms. So that makes me really optimistic that all of a sudden these really trusted institutions that have on-the-ground operations are looking beyond just the access piece, right? They're really thinking about usage, and they're really thinking about what are the other components required to drive forward financial health. So that's the first trend I saw, and I think will be really important in the future. And then the second one I would just highlight is that I think the pandemic really enabled unlikely bedfellows. And again, going back to that financial service provider world, we saw MFIs partner with fintechs. I think you saw this proliferation of fintechs that were really trying to solve social problems and social impact problems, especially around financial inclusion and financial health. And their agility paired with the trust that MFIs have has led to some really interesting outcomes. So a couple of trends that I've seen that I think are going to be really good for financial health going forward, and it's this transformation of the role that microfinance institutions are playing, especially when it comes to the bottom of the pyramid. And I think now the baton is to me. So Francesca, I've got a question for you. And that's really, you talked a lot about your aha moments at the beginning of our conversation. I'm curious what you wish you had known at the beginning of your financial health journey at GoGet that you know now.
So this is such it's almost a catch-22 for me, because I actually call naivety sometimes a strength, because you have this amazing confidence to go ahead when you're naive, because you just don't know what is up ahead of you. So sometimes I do appreciate naivety because it gives me this power innately. However, it is borderline stupidity. It's very close, these two things, if it goes to the edge. I would say, one of the things that I've always kind of championed in terms of financial inclusion was to allow our go-getters to be able to save with a click of a button, to be able to get insurance as low as R1. Actually, today we offer this, which is amazing, per day. And we actually have products where they can get insured only on a daily basis or even 30 days. But to even get here, one of the things that I discovered, which I did not know, was that, of course, this involved a lot of regulatory and a lot of government support, because the trust aspect that you kind of led on to just now, when we rolled out these solutions that were private solutions, privately created by private companies, not government solutions, like I mentioned previously, the go-getters would say, oh, but we would much rather save with what we know, which is EPF, SOXO, the government products. And I say, well, they don't provide products that allow me to send it to them on demand. So I had to create private products first. And that caused a lot of uphill battle, because then the education, the awareness was not there. We have to spend a lot of time saying, hey, don't worry, trust it. It's really good. You can still save. But when you're talking about putting people's money into a certain location, you need to be very, very trustworthy. And so, one thing that I wish I knew is, of course, how important it is to have the right partners. We're very lucky that actually with UNCDF, we entered a program that really allowed us to unlock these partners with UNCDF's on the table, bringing and opening those doors. I think without that, I don't think we would have been able to open those doors any faster. We would be a lot slower in that sense. So that's really elevated us. But I didn't know I would have actually gotten that, so it helped me a lot. Yeah. Thanks.
Francesca, you mentioned about. I was just going to say is that I completely, I call it baby eyes. The ability to look at the world, and it's the best way. So I completely agree with that being a strength.
Okay. Great.
Super. Look, awesome, guys. I am being chased by Rakhi and Palvi. So we'll skip on two things: audience questions. We'll find a way. Rakhi, Palvi, help us find a way to reach out to the questioners offline, and I would try my best to get back. But I'm sure, I think all of us got at least something out of the conversation. I did a few things, and we don't have the time for a formal summary, but I'm so glad that we are having these sort of conversations which are beyond opening accounts and payments, and I think are getting into difficult, ambitious, and adventurous sort of realm. But thank you so much, Payal, Vidyut, Francesca, for joining us. Hugely appreciate it. I really enjoyed the conversation. I hope so did you. Over to you, Rakhi, and apologize for taking a couple of minutes extra.
Not at all, not at all. I'm sure we all were kind of, thinking that, let's push the time a little bit more. Extremely engaging conversation, and thanks, Krishna, and thanks to our panelists. So before we move on to our next and the last session, just a quick note to all the participants. Our panelists would be happy to reply to your questions even on the Q&A box. So, please keep dropping your questions and, responses. It's good to see that there are many questions coming. So moving on to our next session, it's actually a spotlight segment on Commonwealth Bank of Australia. And I'm pleased to invite Ben Greer, Head of Financial Wellbeing Strategy, Commonwealth Bank of Australia. Yeah, Ben, over to you.
Thanks, Rakhi. And I want to thank the UNCDF and the organisers for the invitation today. In the next few minutes, I wanted to share our experience on the business case for investing in financial health, and hopefully inspire some of you to bring this more into your business. So I think where we would start, if you could just jump to the next slide, Rakhi, our business is fundamentally tied to our customer success, and we recognise that financial health is critically important to both individuals and the community. It impacts choices, opportunities and outcomes, both positively and negatively. And for a decade, the Commonwealth Bank has had a purpose to improve the financial being of customers and communities. But around 5 years ago, we realised from the data that we had that there wasn't meaningful progress being made towards this purpose. And this was in the face of, in Australia and probably in many places around the world, great progress in terms of economic opportunity, literacy and access to financial services and banking innovation. We saw data that suggested that there were large groups of the population spending more than they're earning, struggling to secure funds in an emergency, and experiencing, really bad retirement outcomes. And so we established that the traditional approaches that weren't working, and often these approaches were expensive. So we set about taking a new approach that would allow us to have greater impact and greater certainty of achieving the group's purpose, and one that was integrated into the core business proposition rather than being an ESG type initiative. And the new approach introduced a number of new elements. Firstly, we sought to move away from intuition-based interventions and use an evidence base and behavioural science to determine how to achieve change, and build out a behavioural science team. The second was we sought to work with stakeholders and experts in different fields and in the community on the most challenging problems, and turn the research into tangible innovations across products, experiences and policy for the bank. And then lastly, we sought to bring measurement of the impact in a scientific way and share these learnings with the global community. And as you can imagine, if you could just jump to the next slide. Sorry, I'm a little bit behind on slides. As you can imagine, this kind of approach would be unusual in a corporate and took a lot of courage from senior leaders and required patient capital. But as we implemented the approach, it's yielded more clarity and certainty around the business ROI for financial health. If you could just jump to the next slide, Rocky. So if we talk about the benefits, if we start with customer relationships, which great place to start. So for many of the innovations that we have tested and trialed, we've seen improvements in acquisition and funding rates, improved share of wallet spend, improved retention and customer satisfaction. If we talk about margins, many of them, particularly in the lending space, have materially improved things like credit arrears, loan impairment, and risk-adjusted revenue. And a couple of examples of those are on the screen here. So the one in the middle, we were seeking to help customers make a better choice around credit products. And we did that by working with some of our expert partners at Harvard Style Lab and our internal behavioral science team. We're not just talking about what was good about the product, why they should buy it, but also what was bad to help them get to a more compatible choice. And what we saw from a commercial point of view was not just product mix, but shifts, but also increased retention by about 20%, 6 or 9 months down the track, and an increased share of wallet spend of that product, which suggested that they were more confident. In another trial, we sought to help customers in need to connect with government support and reduce some of the sludge in accessing government support. And this has led to over $500 million of additional savings to customers. But more surprisingly, we saw a 15% improvement in retention of the primary relationship, which certainly was not expected when we started that project. And in another trial, we sought to improve the repayment decisions for credit products, and it saw an increase by up to 20% in arrears rates, and or an improvement in arrears rates and improvement in repayment rates. And we've also seen a number of non-financial and strategic benefits ranging from brand and reputation within the community, improved dialogue with the regulator and the government, advances in our aspiration to be the #1 digital bank, and also, I think really importantly, a very engaged and more purpose-led workforce. You could just jump to the next page, Raki. One of the core elements, obviously, is measurement, as I mentioned, and also measuring financial being explicitly. And we think about it like a third cone to the retina of the institution, upgrading the vision and perception from black and white to colour, adding customer outcomes alongside traditional measures of profitability and customer satisfaction. And it's been very helpful to help us understand drivers of financial being, uncover insights and hidden opportunities, and also improve belief and certainty of outcomes. It's helped us understand that customer behaviours are one of the most important factors in financial health, possibly more important than things like income and wealth. And it's helped us understand the strong correlations between financial being and commercial outcomes like risk-adjusted revenue, customer complaints, and net promotion score. And we use this data in our daily business. We provide this data to product teams, to executives, and we report on it regularly in the external environment to help inform policy. And we're starting to look at using it in customer experiences. And we have made this approach transparent and available for peers and the community to use. And the final thought I would leave with is how critical partnerships are, partnerships with researchers and experts, partnerships with community groups, regulator and the government, and also partnerships with the community of practice like the group we have here today. So my final thought I would leave with, if you want to, and maybe jump to the next slide, if you want to make customers better, if you want better customers, make customers better. And I think as a bank and many private sector organisations can play a really big role in that. Thank you.
Thank you, Ben. Thank you so much. That was really, really interesting. And I'm sure we have lots to learn from how CBA has gone about, looking at financial health and, taking it forward. So we now move on to the last, is actually the closing remarks. And I would like Jaspreet to come.
Sorry, my apologies. I think the digital world we live in, possibly these are, some of the issues that our customers at the last mile also face, very often. And possibly, I think the entire idea was, that this is a journey we are starting off, and possibly, we'd like to invite all of you to be part of this journey, and we'll be proactively reaching out to industry and government partners across the world to with different kind of players. We already started looking at setting up a couple of living labs across markets to test out, the impact of this agenda and build evidence and dialogue from there. So we look forward to, engaging with you, and please do download the paper, that we have put together, and we'll look forward to, receiving your feedback and, your comments and thoughts in terms of, how and what we could or could not do in terms of, taking this agenda forward. Thank you so much, everyone, and thank you, MetLife, for, helping us organize this session. Thank you.